Okay. So digital therapeutics, and I'm a behavioral pediatrician, and I was really excited when I got wind of, this possibility of a treatment for ADHD. And I honestly, I wanted to actually go to the source, you, to find out more about it because I think I get a lot of questions in my clinic as soon as things like this come out, like, oh my gosh, Dr. Bauer, should this is something we need to be doing? What is this? Like, what do you think? And I honestly would just I want to make sure that there's no misinformation. And I just wanted to get your input on this because what role do you think digital therapeutics have in the chronic care of ADHD? This is a
Yeah,
new part of chronic care management.
it is. And maybe before I get specifically to the question, let me back up because I think a couple things you said kind of resonate with me and are really important because you and I have both been practicing for a while and we've seen things come and go. And I'm sure parents and providers who might be watching are probably aware of lots of other products that they might see advertised, or I'm always struck by the little stick in the ground signs that say, does your child struggle with ADHD? Call this number and come to our,
Yes.
whatever snake oil kind of clinic down the street. And so I think one of the things that's important to really distinguish about this particular digital therapeutic and really other, not just Endeavor, which we'll talk about, but other digital therapeutics, another thing that distinguishes them and what I spent a lot of the time that I was at Duke working on was how to help generate the clinical evidence to differentiate and to substantiate these are actual medical treatments. These are not just something that, an app that somebody put together in their basement. And now they're out there saying, yes, it can treat with attention. So there's a very, very rigorous process, and we can talk about that if it's of interest, um, through which this treatment was designed, developed, tested, reviewed, scrutinized until it finally gets out into into the into practice where it is now. And so back to the question on chronic care, which is a really really important one. Like you, especially as a developmental pediatrician, I am struck sometimes by our lack of awareness of ADHD as a chronic condition, and we think about it when we routine care even, and our best practices for managing ADHD have to do with usually medicine and behavioral therapy. But a lot of times, even with those approaches, we treat them a little bit like PRN, like, yeah, let's treat it for a little bit, and then if things get better, we do our 8 weeks of behavioral therapy, and then we stop. Why should
Hmm.
we stop? This is a chronic condition, and there's nothing that's actually curative about the treatments that we have today. So I think one of the ways that digital therapeutics can start to fill that gap and start to help with managing the long haul of ADHD is number one by being accessible. So you don't, when you have a digital therapeutic, and this is really true not just for ADHD. This is true for other conditions where there are digital therapeutic, well researched digital therapeutic products. You don't have to schedule an appointment. You
Hmm.
have your course of treatment usually on your phone or on your computer, and that's a game changer. I mean, we all know that access to healthcare is a big issue. It certainly contributes to disparities in who gets the kinds of care. So I think that having an option that can be managed over time in your home makes a big difference.